Intermountain Healthcare's state-of-the-art simulation program provides healthcare workers with realistic, interactive training in cognitive and behavioral skills required for proficient clinical and non-clinical practice. To make each learning opportunity as valuable as possible, it is important that you understand the capabilities of your patient simulator, along with the expectation for your actions during a medical simulation. This video is an introduction to the functionality of the patient simulator that you'll be working with today. This is the Laerdal SimMan3G, a wireless high-fidelity adult patient simulator. The Manikin can be controlled with computer software that is operated by the simulation specialist. Assessing how your patient is doing with a visual assessment can be difficult due to the fact that the Manikin does not move and does not have any facial expression. However, you will notice that the Manikin's eyes are blinking. When your patient's eyes are wide open and blinking, you can assume that the patient is alert and oriented. The eyes can also be half open, indicating that the patient may be drowsy or sedated, fully closed, sleeping, or unresponsive. Another function of the Manikin that will help you assess the Manikin with what you are seeing visually is spontaneous breathing. If you have the question whether your patient is breathing or breathing well, the Manikin does have chest rise and fall. That also includes when applying oxygen with a bag and mask. Respiratory rate will also be shown on the patient monitor. Please interact with the Manikin as you would a normal patient. The simulation specialist has a microphone and will be the voice of the Manikin. Talk to the patient as you normally would, and the simulation specialist will respond appropriately through the microphone. The Manikin also has pre-recorded sounds that may be used, such as coughing, moaning, and difficulty breathing. When using a stethoscope, the Manikin is capable of producing normal and abnormal heart, lung, and bowel sounds. You will notice that the Manikin has IVs in place on both the right and left arms. If you need to administer a medication, please do not verbalize and pretend. Please actually push the medication and use the IV access that is available. The same is true for any fluids that need to be hung. Any fluid that is pushed into the Manikin is collected into a drainage bag behind the bed. If you see these drainage bags during the simulation, please disregard them and pretend they are not there. In the event that you need additional access, an IO may be placed on the Manikin. An IO can only be placed on the Manikin's left leg. The IO site can be recognized by the extra skin wrap on the left leg of the simulator. The same method is used for the IO as with the arms. A drainage bag will be connected and collect any fluid that is pushed into the Manikin. Pulses can be felt on the Manikin, including carotid, radial, femoral, and pedal pulses. To fill a Manikin's pulses, push, include, and release. If you press too hard, you can include the pulse and you will not feel it. Due to the mechanics that are in the Manikin, radial pulses anatomically are higher than they would normally be. A patient monitor is also available to monitor patient vital signs. Vital signs include heart rate, oxygen saturation, blood pressure, and pulse. Once the pulse oximeter and blood pressure cuff are placed on the Manikin, vital signs will update in real time throughout the scenario. In order to cycle the blood pressure, you must hit the start-stop button. Make sure you let it cycle the whole way through. If you hit the button again before the cycle is complete, you will not get your reading. You are also welcome to set the blood pressure to cycle automatically. This can be done by touching the numbers and selecting the desired time of how often you would like the blood pressure to cycle. End-tidal CO2 is also available on the monitor. However, an end-tidal CO2 detector must first be placed on the patient before it can be displayed on the monitor. Temperature will also be displayed on the patient monitor in the bottom right-hand corner of the screen, since you are unable to get an accurate temperature reading from the Manikin. Defibrillators can be used with the patient simulator. ECG leads do not need stickers to attach. The Manikin has pre-placed connection studs where a 3-lead ECG can be placed. The same is also true with defibrillator pads. Pads will snap onto the mannequin. These pads can easily become disconnected, especially while performing compressions. If you notice one of your pads come off during the simulation, just snap it back on. Once your pads are connected to the mannequin and your pads to the defibrillator, you can use the defibrillator as you normally would. You will get a heart rate and a rhythm that will match what is being displayed on the patient monitor. You can perform a cardioversion, transcutaneous pacing, and shock the patient. Please be aware you will be using an actual defibrillator. It is not a simulated piece of equipment. When you apply a shock, you will actually be shocking the simulator. Please be safe and make sure everyone is clear before you apply a shock. If you're using a Zoll defibrillator, place the Zoll defibrillator pads on the front and back of the patient. Also connect the electrodes to the mannequin's connection post located on the mannequin's torso. You are now able to use the Zoll defibrillator as you normally would, including CPR feedback on rate and depth of compressions. You may also encounter medical moulage in your simulation. Medical moulage is a way to add realism to the simulation. This can include bruises, open wounds, blood, sweat, or emesis. When your scenario is complete, we want to make sure that none of the supplies used in the simulation leave the room. Many of these supplies can be collected and reused for future simulations. We also want to ensure that no simulation supplies are ever taken to an area where they might be used on an actual patient, causing them harm. Please check your pockets to make sure you're not taking any simulation supplies with you. This includes any syringes, vials, medication, or IV caps. You do not need to worry about cleaning up. Please do not throw anything away. The simulation specialist will take care of all room cleanup. After the simulation, your facilitator will escort you to another room for the simulation debrief to discuss the simulation that just took place.